Hi everyone, my name's Mike Lang and I'm an education consultant with Cancer Control Alberta. Like I mentioned before, I'm a cancer survivor myself, and although I did not undergo a stem cell transplant as part of my treatments, I do remember how being in the hospital sometimes felt like a whirlwind of appointments, tests, and procedures. That's why I think it's important to understand generally what will be happening before everything gets going. In this video, we'll hear from a transplant doctor, Dr. Brown, and a registered nurse, Lena, as well as Victoria and Scott. They will provide you with a general overview of the allo transplant so that you can have some idea of what will be happening and what it could be like for you. Of course, the specifics of everyone's treatments and side effects will be unique, but by listening to Victoria and Scott's stories, as well as Dr. Brown and Lena, you will be able to get a clear picture of what your stem cell transplant could be like. So, let's get started.
So after the workup, you go through chemo, so you would absolutely get put in the hospital, and then you go through about 5 to 10 days of chemo, and then after that, you get your transplant right away. You feel very weak after chemo, of course, because you don't have an immune system, so your body feels incredibly drained. The nurses come in and they're really upbeat because it is exciting. You're getting something new and you're essentially going to be better. They bring in the bags of stem cells and they hook it up like any blood transfusion, and it goes right into your central line.
When things really get going and you start the transplant, you enter into a calendar that is uniquely yours. Day 0 is the day of the transplant. The minus numbers are talking about your conditioning, and the conditioning is essentially all the chemo and radiation that we're going to give you to try and get rid of your disease, and in the process destroy your blood producing marrow and your immune system. So depending on the protocol, it's day -8 is a usual one for us, and it goes up to day -1, and then on day 0 you actually get transplanted, which turns out to be rather anticlimactic because we are transplanting stem cells. There's no surgery involved. The stem cells have been collected from the donor. They're put in a small bag that looks like blood, and it's hung up on an IV pole like blood, and it goes into the central venous catheter that everybody has, and that's it. And the stem cells go in with all the other cells that are mixed in that bag of blood, and away they go. And they just figure out where to go and plant themselves in the marrow, in the soil of the marrow, and start the process.
So the actual day of the transplant is a really exciting day for most of the staff on the unit. So you might hear a lot of people coming up to you and saying happy birthday, congratulations, making you balloons, and we really encourage you to get in that spirit of celebration because it is a really exciting day. So the actual infusion of cells may take minutes to hours depending on how they were collected and the volume of cells we've collected. But during the infusion, you should feel just fine, depending on whether the cells collected are from a compatible blood type or not. You may or may not receive pre-medications like Benadryl, or you may just receive the cells themselves. And you shouldn't feel anything weird during the infusion. You should feel just fine, and just fine for the rest of the day, actually.
As of day 0, you've had all your conditioning, so your counts are doing nothing but going down. The seeds don't just spring up magically in a matter of hours. They have, just like your garden, they have to plant themselves, get happy, be fed, and begin to grow. And that is a process that's measured in days. Now, whether it's 10 days or whether it's 20 days or 30 days, that depends on the transplant itself. Somewhere in that 3rd week, maybe a little bit before, most people's counts start to show up. So there's a lot of risks during that time, but once the seeds do start to take, you actually do see in their weekly blood or their daily blood work, oh look, now it's 0.1. Oh look, now it's 0.3, etc., etc. And so the recovery begins to take place in that roughly in the day 14 to day 21 range.
So after the cells are infused, you should feel just fine. And people tend to feel pretty good for the next couple of days that follow. So you may come and see us maybe 3 days after you transplant and check in with us for some blood work and see how you're feeling. Around day 6 or 7, people might start not to feel so great in terms of nausea, malaise, just something shifting in how they're feeling. And depending on what the healthcare team thinks, we may or may not keep you after a week or so overnight. Certainly by day 10, 11, 12, we're hitting the rough spots. So this is where your counts have really dipped, and you might start to feel things like mouth sores, difficulty eating and maintaining your oral intake. You might develop diarrhea. You might develop vomiting that you can't control with gravel at home. And these are all reasons to stay overnight with us for the next few days to weeks until we get you feeling better. So one of the things we find is that during that critical time period where you're not feeling well, a lot of people are inclined to rest a lot and stay in bed. And our philosophy is always that we need to be making an effort to stay active and get up out of bed every day and do some daily activities of living, whether it's just walking to the sink, brushing your teeth, and going for a lap around the unit. We also have physiotherapists on the unit who will check in on you if you're having particular difficulties with this and help you get your steps in daily. But we know for sure that those who stay more active tend to recover their energy much faster than those who don't.
The more active you can be, the better. I mean, when you're in your room for prolonged periods, it can just sap you. And when you have opportunity, I mean, there's times when you're very ill or things are happening where they're serving roast beef on one of the days of the week and you smell that and you're nauseous. Might not be the day to go for a walk. But if that's not the case and you are able to go for a walk, or if you're strong enough to do stairs or go on the exercise bike, or just even if you're on the ward, you could, just get out of your room and see something a little different. It feeds you. It helps you as a person just to physically get your body moving, just the blood flow. It's very, very important to move.
Where the patients feel it the most is right in their mouth. Because all those cells that line your mouth and your tongue and your throat, they fall apart and they can't recover. They can't just fix themselves. So you essentially break down the initial parts of your defensive barriers. It's the castle walls, essentially, of your mouth. You have the worst canker sore you can imagine. If you remember being a kid, or even now, this is your whole mouth being a canker sore times 10. And so that often requires them to have the biggest painkillers we can provide for them to be comfortable. So if you ask a patient after they've come out of hospital, what's the worst part of the transplant? Most of the time they'll tell you it's the mucositis. It's that pain. Everyone is well aware that if you get a kidney transplant, a heart transplant, a lung transplant, everyone worries about the organ being rejected. And that's because the patients in those situations have an intact immune system, which is the job of which is to protect the patient from foreign things. And a new kidney from somebody else is a foreign thing as far as their immune system goes, and it will try to get rid of that organ unless you can blunt it somehow with drugs. In our situation, the transplant product is supposed to be the stem cells, the new seeds for the garden, blood garden, but you cannot avoid bringing along the donor's immune system with that those stem cells. So you are transplanting someone else's immune system into you after we have eliminated your immune system with the conditioning protocol. And so you are defenseless in relation to the new immune system. And that new immune system, once it comes in with the stem cells, if it wakes up and says, wait a minute, this is not me, then we have a problem, because that new immune system will try to do what the immune system does and destroy the foreign object, which is now the patient. So that's the reverse of organ rejection. It's actually the organ rejecting the patient, and that's graft versus host disease. We don't want you to have graft versus host disease. We don't want you to suffer from graft versus host disease, and we will try and protect you against getting the graft versus host disease in the first place. It's not perfect, and if you get it, we will treat it aggressively if we have to. The therapies in our game are always potentially very nasty in and of themselves. So it's a challenge. The most important thing is communication. The patients have to understand that we are there for them. They are not imposing on us at any time, and that it is far better for them and for our chances of dealing with things to hear immediately when they are uncomfortable. Not physically uncomfortable, but just, I'm not really sure what this is. I wonder if I should talk to somebody. The answer is always yes. Call. And you will be speaking to someone, if not directly, then in a very short number of steps, to somebody who can say, we need to do this. And away you go.
So while you're an inpatient, we have a really broad healthcare team. We have dietitians on the unit. We have physiotherapists, we have social workers, and we have psychosocial support. We're also able to access spiritual services support. So even though you'll be most connected with your nurse and your doctor every day, we can always reach out to these other specialties to help any given issue that you're encountering. So once we get you feeling better in the inpatient unit, we'll prepare for your discharge, and your team will do a lot of teaching regarding medications that you'll be going home on and making sure that you have a good idea of what those are and the schedule and how to take them. We'll also provide you with contact information for what will now be your outpatient team and who will be taking over the care from now on. And just we'll go over signs and symptoms that you should be reporting to your outpatient team, and just making sure that you're feeling comfortable enough to go home and that you and your caregiver know what to do at home should you encounter any new symptoms or concerns.
Well, hopefully this video gave you a clear picture of what the inpatient stem cell transplant process is like. Once you go into the hospital, you'll get some pretty strong chemotherapy that will essentially destroy your own immune system. And then on day 0, you will have the infusion of the donor stem cells, which are the seeds of your new immune system, like Dr. Brown said. From there, it'll take a few weeks for those seeds to take root and grow to the point where your healthcare team feels like you're ready to leave the hospital. I think it's important to emphasize that this is not an easy process, and there can be serious complications like graft versus host disease or painful mouth sores. But your caregivers and healthcare team will be with you every step of the way. What really matters is that you are communicating your needs to them so that they can provide the support that you need. And like both Scott and Lena mentioned, do what you can to stay as active as possible despite feeling sick and weak. Well, that's it for this video. When you are ready, feel free to watch the final video of the series about the recovery process. We'll see you soon.